Quick study tips for nursing school. The beginning of nursing school can be a little difficult. You may have been a straight A student in high school and all of a sudden you're in nursing school now and you are making C's. If this is the case, you may want to meet with your instructor. Some instructors will give you study tips on how to study. If you are not successful there, when you are studying, make sure that you go by your syllabus. Usually there's an outline in there for the chapters that you're going to cover. In your book, there are usually objectives at the beginning of each chapter. So read those objectives at the beginning of each chapter. Additionally, there may even be a terminology box. If you are a new nursing student, there are so many terms that you may not be aware of. During your testing in nursing school, some medical terms may be on there that you don't know. So it will be very helpful if at the beginning of each chapter, it does not matter what course you are taking. You could be a 2-year med-surg student. You could be taking mental health, and especially during mental health, you want to make sure that you know your terminology because it's so different. Read the terminology and remember the terminology. Additionally, when you are going through the chapters, make sure that you read what is in the boxes. A lot of times, very important information is located inside of those boxes. When you are studying for your test, do not hesitate. I actually strongly recommend that you always answer the questions at the end of the chapter. Now, when you answer those questions are totally up to you, but I strongly recommend that students answer one question when they're about halfway through reading the chapter, just to see how the questions are worded and to make sure that they're on the right track, but then leave all those other questions to probably maybe 5 days to 7 days out from a scheduled test so that you don't use up all of your questions. And again, the questions at the end of the book, I consider those to be important. There should be questions. Well, sometimes there are not. There are some books that don't have questions at the end of the chapter, but if those questions are there, please don't hesitate to answer those questions. Practice those questions before your next test. Additionally, when you are studying for your test, if you have a lab to go with your class, do not hesitate to cover that information that is in lab for your lecture test, especially if you never have quizzes in lab, or even if you do have quizzes in lab, because sometimes information from your lab class can make it into your lecture class. Why is that? Because basically you're covering the same thing. It's just that labs is more hands-on. So please don't forget to study your lab information in addition to your lecture information. Also, in nursing school, if you are having an issue getting in-class questions right, and every time or almost every time that you answer an in-class question, you feel like you always choose the wrong answer. The way to get better at this is to find high-quality questions. High quality questions. So you're looking in the back of your book. If you have ATI, you are looking there. There are also some in-class style question books that are out there that has tons of questions related to the chapters in your lecture books that you can answer. The more high quality questions that you can answer, the better you will get. But please remember, all in-class questions are not the same. They must be high quality questions. I feel that if you follow these few tips, then it should help you to do better in nursing school.
Don't forget to subscribe, like, and share.